Dr. Clearfield. Appreciate it. Would you like me to share my screen so I can present?
Yes, please.
Okay. Let me get the PowerPoints put up here. All right, are those visible?
Yes, they are.
Okay. Okay, well, it's a real pleasure to be able to give you guys a round robin discussion here on some very important details of brain health, and what I believe is probably one of the most actionable things you can do for your patient population and yourself. So we're going to be talking about the implications of DHA and lutein, and also zeaxanthin in brain, not only architecture but also brain actual function. So let's see if I can get my screen to advance. So, as Dr. Clearfield mentioned, I'm a chiropractor by training. I practiced nearly 30 years as a functional medicine chiropractor, and was practicing functional medicine well before, actually before it was even called functional medicine, and was just absolutely taken by the work of Jeff Bland when I was in school, and never lost sight of that. Today, I'm also an entrepreneur, so I have a keen interest
Hey,
in.
Deb, just calling you to say.
I have a keen interest in developing products to advance the health and wellness of people at large. So today, I own and operate a company called Sierra Nevada Bioscience. We're a certified GMP manufacturing facility, FDA registered. We're USDA organic, and we've been in the manufacturing business for over 5 years now, and have seen some pretty significant growth. We're located here in Reno, Nevada. Before I actually started my functional medicine practice, my undergrad degree is in respiratory therapy, and I started my career in the neonatal intensive care nursery. So I worked with premature babies for 9 years. So I basically saw the miracles of life from the very beginning, from 21 weekers that were under a pound to full-term infants that were in severe respiratory distress or had necrotizing enterocolitis or all sorts of other conditions. So it gave me a real reverence for the human condition and the resilience of the human condition as it related to recovery and being able to thrive given the right circumstances. It also gave me a keen understanding that the medical system was completely disoriented in the way it approached health. And my first inclination was to go to medical school. And then when I saw how disconnected the parts were and the specialties that managed those parts were so disconnected, it gave me a second thoughts towards how I really wanted to approach my career in healthcare. So I went into the functional medicine model directly out of school. I actually went to University of Western States up in Portland, Oregon, because it was a portal of entry school, a portal of entry physician school. They actually are the only school in the nation that taught minor surgery. They were delivering babies. They were doing gynecological exams. They were really a frontline primary care training facility for chiropractors, and they still are today. And I really gained quite a bit of insight into the functional medicine model through that training. And for those of you who are not familiar with the functional medicine model, we use this thing called the functional medicine matrix, and we look at antecedents, triggers, and mediators over on the left-hand side to kind of get a sense of where some of these underlying issues are coming from. And that model helps us to navigate and evaluate the patient in a more holistic managing realm. So tonight, we're going to talk about a product I developed. It's a very unique product that there's nothing like it on the market. Like I said, we manufacture everything that is in my Brain Bean line. I have a line called Brain Bean, and that line of products is specifically designed for neurological enhancement. And my tagline is to improve people's mood, mind, and memory at the bottom of this slide, at all the slides. And this product in particular is going to be featured in some of the, is really going to be talked about within the realms of the research that we're going to be looking at. So a couple of things to keep in mind during this talk is that DHA and lutein don't have any RDI. There's no recommended daily intake for either one of these critically important nutrients that we can't live without. We can't live healthfully without. So the average American is getting less than 2 milligrams of lutein per day and less than 100 milligrams of DHA per day. And this is woefully inadequate for optimizing neurological function, brain health throughout the lifespan. In addition to some of the products that we make, I actually roast coffee. I became very, I love coffee, but I also became very interested in the health benefits of coffee. And there's no doubt it helps my personality. So that's why we call the product line Brain Bean. I actually started with a coffee and then branched out into the supplements, and we have a very well-received coffee line in addition to our nutraceuticals. But coffee is also healthy for you. It's not just good tasting. It actually reduces your risk for diabetes by 29%. And as we probably all know on this particular call, Alzheimer's is considered type 3 diabetes of the brain. You can also reduce your risk for Parkinson's by consuming coffee. The more the better, it seems. In fact, if you consume greater than 3 to 4 or 5 cups, you're reducing your risk for Parkinson's. And there's many reasons for this, from fatty acid metabolism to also the bowel function that coffee serves for a lot of people. And as we might all know here, one of the key symptoms of Parkinson's is constipation early on in their life. And so having proper bowel function, and coffee seems to help to stimulate bowel motility. So today we're in the midst of what's been termed the silver tsunami, and the silver tsunami is crashing upon the waves of the healthcare delivery system in a big way. And we're not ready for it, nor are the people that are involved in the disease process of this silver tsunami ready for it either, because once you get to a certain level of decline in your neurological health, there's really not a lot that can be done, as we're going to be discussing. Let's see. So right before the pandemic hit in February 27th of 2020, this Blue Cross Blue Shield report came out, and it was stunning how much the dementia rate has grown across the age range. And what they discovered, the Blue Cross Blue Shield took a retrospective analysis of their insured, and they looked at the rate of increase over the course of the last 4 years, 2013 to 2017, of dementia. This is actual diagnostic, these are diagnostic codes that they were looking at. These people were diagnosed with dementia. And there's a 407% increase in the age 30 to 44, 242% increase in 45 to 54, and 90% increase in 55 to 64. Now, we used to think of dementia as what would be considered an old person's disease, but clearly, it's no longer holding the course within the elderly. It's actually increasing more in the young population, and there are many reasons for that. So from Gen Z to the baby boomers are all now showing significant increases in the rate of dementia. So this is scary. This is something that is not going to go away unless we start to really educate the population at large, and that's one of my goals and objectives with the Brain Beam products and with this talk today. So dementia doesn't, and Alzheimer's disease is the most common form of dementia. It unfairly affects women. So 1 in 6 women get dementia as opposed to 1 in 11 men. So 65% of all the Alzheimer's cases are women today. And many of these are underdiagnosed really, because in order to get to the point where you're actually diagnosed with what would be considered Alzheimer's, you're deep into it. You're well into it. You're forgetting things on a regular basis, and you are now on the slipperiest slope that you could possibly be on within the confines of that disease diagnosis. We also know that there's a significant relationship between dementia and body fat, and in particular the belly fat. So 70% of the US population is overweight or obese, and this increases the rate of dementia risk by 39%. So women that are age 50 or older that have a large waist size, a waist to hip circumference that's abnormally high, in fact, not even that high, 34 inches, significantly increase their risk for dementia. And you can also image their brains, and you can see that the hippocampal volume is actually shrinking within these women. And it's also men too, but because it affects women more readily, a lot of the studies have been done on hippocampal volumes in women. So body fat and brain size are directly related. So we need to keep that in mind when we're assessing our patients. And you should be telling them this. We also know that 80% of the population, or 80% of the people that are diagnosed with Alzheimer's have type 2 diabetes. This is an old stat. I looked up the new numbers before this talk today, and it's 88 million, I think. 86 to 88 million now. So literally 1 in 3 Americans right now is pre-diabetic. And that sets the stage for this slippery slope that is inciting the dementive state. There's no test right now that actually diagnose dementia. There's a battery of tests that you can take in the office, the SAGE test, the MoCA test, and those are very gross tests, and those don't really give you the true underlying mechanism of what is really causing dementia. So what is the normal here? And we all know that, you know, the normal tests that we're used to seeing on LabCorp or Quest are based on the population that's being studied. So we're studying a population that's 70% of that population that's running these tests is obese or overweight, and that's not a normal healthful state. So normal is a very arbitrary number, and we need to keep that into consideration. And I think most of the people on this call already recognize that normal is really just not normal, because most people are not in a healthful state. So there's things that can incite the risk of dementia even further, and one of them is stress. And so stress actually increases the HPA axis and this hypothalamic pituitary adrenal drive, this sympathetic overload, this allostatic burden that seems to take place, increases the risk for developing Alzheimer's and dementia by 233%, as opposed to 120% for those that might have small vessel disease or have maybe hypertension. So oftentimes, we're misappropriating our intent by not taking a look at the stressors that are impacting the population that we're actually trying to help, and looking more at things, you know, quantifiable numbers, blood pressure, systolic, diastolic blood pressure numbers that we can actually measure. And I know those are important, but really we may want to refocus on some of these stressors and look at some of these things that are really driving the overall burden of the risk for Alzheimer's and dementia. We also know that this is before the pandemic. This is a slide I had used a few years ago, and this is this idea of deaths of despair. And this came from I believe it was the World Health Organization. And this shows that, the deaths by drugs, alcohol, and suicide were rapidly increasing in the United States. And these were secondary to stressors, drug overdoses, and a number of other things. And it should be kept in mind that suicide accounts for 2 times the amount of people that die from homicide. So there's twice as many people that are killing themselves versus the amount of people that are dying from homicide. And that even includes today, even with the violence that is going on. So we need to also consider that when we are approaching our patient population and diving a little bit deeper, maybe into a history and availing them of some options they may need for interpersonal help and therapies of that sort. So the HPA axis regulates the stress response. And, if we look at the mechanisms behind dysregulation in the HPA axis and depression, they lead directly to Alzheimer's disease pathology. You can see that the glucocorticoid receptor is downregulated. There's negative feedback inhibition. There's hypercortisolemia. There's this expression of the amyloid precursor protein, and this all leads to this pathology we quantify or we look at, by the way, on autopsy. There's no real good way to look at it yet. There's some CSF studies that are coming out now that might be useful down the road, but these all manifest as AD pathology. However, they all present as depression. So we also know that inflammation is another precursor to developing the Alzheimer's disease pathology, and inflammation comes in 2 forms. It comes in sterile and pathological inflammation. So sterile inflammation is like tissue that's breaking down these pathogen-associated molecular patterns that are from infection, or these damage-associated molecular patterns that incite this low-grade chronic inflammation that comes from tissue breakdown. And there's many reasons why tissue breaks down. And one of the reasons we'll be talking about is DHA and lutein. This decreases brain-derived neurotrophic factor, suppresses neurogenesis, and leads to a general decline in brain volume and neurodegeneration. So depression should be looked at through the lens of a brain disease and not a disease of mood. And really, people need to start to reorient themselves around this concept of depression being a brain disorder and not a mood disorder. And when we look at it that way, it's going to be much more beneficial to our patient populations that we're serving, because depression is very clearly related to the onset, the early onset, the very beginning onset of Alzheimer's disease. And this includes in young individuals as well as old. And this may well be why we're seeing these rapid rises in the young people and developing these diagnostic codes inside the medical delivery system. So 21% of the people who have depressive symptoms go on to eventually develop dementia. We're going to see this number rise. I guarantee it. This number is going to continue to rise. And so we need to be very vigilant in discussing these types of things with our patient and be very forthright with them, and not as a scare tactic, but as a way to incite them for change. So there's definitely some things that can be done surrounding depression outside the pharmacological realm, and one is fish oil, docosahexaenoic acid. There's strong evidence that DHA acts as a very strong antidepressant. In fact, of the major omega-3s, EPA, ALA, EPA, and DHA shows the strongest effect for antidepressant impact. We also know that 99.6% of all the drug trials to date have failed when it comes to averting the Alzheimer's condition. So we know drugs aren't the answer. Drugs clearly aren't the answer, and we're targeting we're looking for a single target within the drug realm to stop this pleomorphic condition that's attacking our brains and our bodies. So we have to consider what we're doing when it comes to strategies to basically build back our brain structure in our patient population or even ourselves. Now, I don't know if you guys were aware, but this is from the Science Journal and just in the 21st of July, 2022. And this is, this shook the field. A very well-known neuroscientist friend of mine from the local medical school, she's the dean of the medical school here, she sent me this that morning and she was completely shaken by the revelations that this article revealed. And basically what it revealed is that the science that preceded, the science that was developed that was pointing at beta amyloid as being one of the major implicators of Alzheimer's disease pathology was fabricated within the research studies that were submitted to peer-reviewed medical journals. And this is absolutely shaking the Alzheimer's science to the core. And this is going to be a big deal, and the story is still emerging on what the implications of this are. But the bottom line is NIH funded this particular line of thought to the tune of literally millions and millions and millions of taxpayers' dollars, thinking that they were running down the right road for developing strategies to avert Alzheimer's disease based on the research that was conducted and then ultimately perhaps fabricated. So stay tuned to this story. This is going to be a big deal, and it's going to alter the landscape in which we're operating within the Alzheimer's disease world. So Dale Bredesen, who I think many of you may already know who he is, but Dale Bredesen is a MD PhD, very well-known individual in the field of Alzheimer's disease. And I put this up there just because I love the title of it. He does a great job of describing how we should be really viewing the Alzheimer's disorder and Alzheimer's diseases as a systems network disorder, a chronic stress, dyshomeostasis, innate immunity, and genetics. I mean, that's not a single drug that's going to impact any of that. There's no drug I know of, maybe exercise will help with a lot of it, but there's a lot of moving parts within the realms of the Alzheimer's disease pathology and dementia pathology. So we need to really reframe our way of thinking about it. It's not just simply losing synaptic connections. It's not gaining more acetylcholine. It's not putting somebody on Aricept and patting them on the back and saying goodbye. This is a multifactorial disease process that we need to be thinking very systemically with. So let's dive into some of the things I think that you guys will find useful. And I want you to walk away with this, from this talk, with some insight into understanding that the eye, when you do an eye exam, you're looking at the brain. And John Dowling has a book that I've got this book, by the way. It's a very deep book. It's mostly physics. And all the ophthalmological residents and doctors will be using this book as a textbook to conduct their course of business and their understanding of the retina. And if you read it, it just says the retina, but then you look below, it says an approachable part of the brain. And so what we really need to reframe our thinking around is the retina is actually the brain. And we're able to see through the eye exam what possibly is going on with the brain and pick up early signs of brain disease in the retina. And in particular, what we really want to focus on is the macula. And there's ways to detect macular degeneration very early now that's not usually available in typical primary care offices, but you can now start to look at macular degeneration very early as an early sign of neurodegeneration. So the macula makes up this little freckle in the back of the retina, and it's composed 100% of lutein, zeaxanthine, and zeaxanthine. These are carotenoids that you get from your diet. So these things are selectively deposited inside the macula at the back of the eye to do some very special features. Now, we get lutein and zeaxanthine from our vegetables. At least we're supposed to. But remember, I told you that we're only getting less than 2 milligrams, and we need a heck of a lot more than that in order for us to have a healthy macula. And in fact, when you look at the availability inside some of these foods, and you may be eating some of these foods, the lutein and zeaxanthin concentrations have significantly declined based on some of the agro-farming techniques that we're using. In addition, because the lutein and zeaxanthin are fat soluble, you have to really chew those up and digest those correctly with your stomach acid and your maceration and all that stuff in order for you to get the bioavailable lutein and zeaxanthin from those. So you will have a hard time getting enough lutein and zeaxanthin from these types of foods. That's why I think it's imperative that everybody is supplementing with lutein and zeaxanthin and DHA. So lutein and zeaxanthin sit in the macula, and their primary role is to protect you from blue light. The blue light comes from the sun. It comes from the sun when the sun rises in the morning, and it basically acts, the blue light, back in Paleolithic times, it would act as a signaling molecule to tell you that it's daytime and that you should shut down the melatonin production, and you would create this circadian biological response that starts to shift you into the alert stage of your day, and you were able to go out there and start to hunt and gather food and look around and be alert and do all those types of things. The problem is that we're exposed to more blue light from our screens that we're on than ever before, and it's the same blue light that the sun exposes us to. So that blue light now is not only altering our circadian biology, but it's also exposing the macula and denaturing these macula, these lutein and zeaxanthin in a very profound way that it's actually damaging and can damage the macula, especially if you don't have enough of it gathered together in the back of the eye and the macula. So some of the symptoms that you see with blue light exposure or eye fatigue, I think we all have experienced that. I know I do fairly frequently, especially if I stare at my phone. But my screens, I've been trying to get those a little bigger and standing further away from them and not spend as much time as I used to. But I think we're all stuck on the screen today, and we need to be very aware of that. And we should be using things like blue filters on our light or on our eyes. We should be using things that can knock down the blue light during the evening time so that we don't disrupt the circadian biology. And we should limit exposure as well. So, this overexposure to the digital environment is having profound effects on a lot of things in our body, from the way in which we move, the proprioception, the fact that we're overstimulating the occipital lobe and we're understimulating the movement area of the brain, the cerebellum, and we're creating postural aberrations by leaning forward all the time with our phones. I mean, I see it so often. I watch some of the staff that I have, and they go on break, but they're walking with their phones. It's like, oh my God, we've got the zombie apocalypse happening. So I think it's really imperative that we really consider eliminating or reducing the exposure to some of these digital apparatuses as we want to be healthier. Years ago, this chair you're seeing there, that was a company of mine that I brought to the United States. I put this all over the North American continent. It's called the Swapper. And the reason I brought that to the United States and launched that company was because it allowed you to sit and move. I put it in the Museum of Modern Art in New York City and got a tremendous amount of awards from all sorts of different organizations, from ergonomic organizations to other organizations that really started to see the value of moving and sitting. You're still sitting, but you're at least able to develop some movement. And so I really recommend that you get up and move frequently if you're stuck at a desk. On average, Worldwide, we're spending almost 7 hours a day on our screens. That's way too much, way too much. So AMD is associated with loss of macular pigment in the macula, and it's called age-related macular degeneration, and it's basically looked at as an early marker for Alzheimer's. And this is back in 2011. It goes back further than that, but I just wanted to show you that this isn't new stuff. So AMD is the leading cause of blindness in the United States and the world today. And it's simply a loss of macular pigment. Those two carotenoids, lutein and zeaxanthin, they're not there. So you start to lose central vision and you get blind. Well, they analyzed 7,876,499 people in this meta-analysis, and their conclusion was very clear. AMD was also significantly associated with increased risk of AD and cognitive impairment. Significant associations between dementia, AD, and AMD calls for greater clinical awareness. So we need to be aware of that. If you're hearing your patient saying, yeah, I think I've got AMD, you need to start taking action right away because their brain is at risk. Lutein is deposited in very specific areas in the brain. It's deposited all over the brain, but it's deposited in the frontal cortex, auditory cortex, hippocampus, and the occipital area in large quantities. And these areas are there, the lutein is deposited there for a number of reasons, but mostly to protect the brain from oxidation and degeneration. So macular carotenoids should be looked at now, lutein and zeaxanthin, as neuroprotectants. They neutralize free radicals, they protect against DNA damage, they ameliorate mitochondrial dysfunction, they modulate low-grade inflammation, and they absorb blue wave light in the eye. These are not eye substances, they're brain substances, and your eye is part of your brain. So when you look at where lutein is incorporated, it's actually it's a transmembrane molecule. So if we look up here at the top up here, you can see the membrane, the lipid bilayer, and you can see lutein spans that layer. And it does that because it gives the membrane and the structure of the cell structural integrity. And it sits right next to, as we're going to find out later, sits right next to docosahexaenoic acid. And there's an inverse relationship between the oxidative burden of DHA and lutein in the membrane. So if you don't have enough because you're not eating enough or you're not taking enough lutein in your diet or supplementing with it, your cell membranes are at significant risk for breakdown and increasing the gap junctions, harming the mitochondria, creating DNA damage, and a whole host of other things. In addition, they also help to protect, as I've mentioned, the blue weight activity in the eye. So here's what's interesting, and I hope you appreciate this as much as I do. Lutein is selectively absorbed into the body and into the brain at 500 times the level of any other carotenoid, despite only having maybe 15% of it in our diet. So let's say that another way. You absorb 500 times more lutein than you do any other carotenoid in your diet. And the reason is because it's so important for your brain and your eye. So if we look over here on the left, the solid yellow is the serum, how much is in our serum. There's no correlation between, and the line right next to it, this big tall line right here, this is how much is absorbed into the brain. There's no correlation between serum levels and brain levels. There's a selective and preferential absorption into the brain and neural tissue of lutein and zeaxanthin than any other carotenoid that we ingest, and we don't get enough of it. So this is another study. This is a study that I think that really stopped me in my tracks when I read it. And this was a Georgia Centenarian study where they took individuals that were in their 100th year of life. They're centenarians. They were coming into their 10th decade of living, and they agreed to go through testing for cognition and then donate their brains upon death. And so they wanted to determine whether or not there was a relationship between how much carotenoids they saw in their macula and how much in their brain did they match. And then also, did that correlate with cognition? And sure enough, it did, hand in hand. It correlated, and this is an ongoing study, so there's more and more of this research coming out. But this is a game changer when you understand this. So the higher the level of lutein in the brains, the better these centenarians performed on cognitive testing, significantly better. Macular pigment optical density correlated directly with lutein levels. In other words, when you increase your lutein and you increase your macular pigment levels in your eye, you're also increasing your macular pigment levels in your brain, and you're increasing your ability to function better as you age. And this is significant. We also know that that in healthy young adults, it does the same thing. So one of the things they were using when they first started doing studies, they had to use a control group. So they used the control group at Georgia, the University of Georgia. And at the University of Georgia, they give free tuition to anybody that maintains a B average or more. So it's really hard to get in there. So these are smart kids. So they thought, heck, they're not going to show any change in their actual ability to perform better if we give them lutein. So they'll act as a control. Well, it turns out they actually got better, and they got significantly better. So supplementation with these young kids with lutein and zeaxanthine improves CNS xanthophyll levels and cognitive function in the young, healthy adults. Magnitudes of effects are similar to previous works reporting correlations between macular pigment optical density in other populations. In other words, it works almost as good as it did with the older people. And here's what they found. This is the results. So you can see that when on the left-hand side here, this macular pigment density, this is what they were testing. They were testing for complex attention. And these were the people that did not get the the xanthine supplements. So they were taking 12 milligrams of lutein and zeaxanthine. These people showed significant rise in their ability to be more attentive to complex situations. The people that got didn't get any xanthine supplements, showed no change. Same with improvement in spatial memory. In other words, they were able to basically have better spatial recognition over the course of the treatment. So they went on to actually look at this in adults, in older adults, and the average age was 73 years old, and they wanted to see whether or not they had the same type of improvement. And so you can see that their complex attention with the lutein and zeaxanthine supplementation compared to placebo, the placebo actually went down. But the lutein and zeaxanthine in these 73-year-olds taking 12 milligrams of lutein and zeaxanthine, their complex attention went up. Their executive function went, look how high this went. I mean, compared to this, it's significant. And their cognitive flexibility, their ability to switch and change and remember things and stay congruent in multiple, in changing scenarios like driving a car, that's significantly improved as well. So there's robust evidence that the lutein and zeaxanthine works directly on the neural tissue in improving cognition in both the young and the old. Now, one of the things that there's a lot of research. There's so much new research that's coming out. I can't get enough of it. I mean, it's just amazing. You're going to hear a lot more about it, but you know about it, and I want you to take advantage of it. One of the things that happens as you start to age, you start to lose this thing called white matter integrity. So if you do an MRI, you start to see the loss or the thinning of the white matter. The white matter is the myelin in the brain. The myelin in the brain is there to help conduct nerve traffic faster. So the less you have, the slower your neurological function is. So the idea is that if we give people lutein and zeaxanthin, does it help to improve their white matter integrity? And sure enough, it did. So their conclusion was this current study is among the first to use neuroimaging to measure the relationship to lutein and zeaxanthin in vivo. And what they found was that the current study tested the relationship between retinal macular pigment optical density. So they looked at the macular pigment and serum concentrations, and they found that the white matter integrity was directly related to the level of macular pigment optical density, how much was in their eye, and their lutein levels. Now, when you start to read about the implications of having proper white matter integrity, you run across articles like this: white matter integrity and vulnerability to Alzheimer's disease, preliminary findings and future directions. AD risk has been associated with white matter integrity declines in tracts that connect gray matter structures associated with memory function. These tracts include the parahippocampal white matter, the cingulum, the inferior frontal occipital fasciculus, and the splenium corpus callosum. That's what they measured over here and showed that they were improved. So not only are we seeing better function with memory and cognitive flexibility, but we're also seeing functional, actual structural integrity improvements with lutein and zeaxanthin. As we age, we start to lose some of the neurotropins in our brain. The neurotropins in our brain help to support the repair and robustness of our brain function and structure. One of those very important substances is called brain-derived neurotrophic factor. I chose to use this Lutamax 2020 in my supplement because it is got, I'm counting 60 research studies now on Lutamax. But one of the things that caught my attention right away was the fact that when you give somebody for 6 months, the Lutamax 2020 that's in our product, you're increasing their brain-derived neurotrophic factor significantly higher. So you're seeing significant rises in BDNF when you compare it to, on this other side, the placebo, where they're getting nothing. So having proper BDNF, exercise does it, but so does the lutein and zeaxanthin supplements. So it's important to have these neurotrophins so that you can basically repair and maintain the integrity of your neural structures through BDNF. Now, you can't study this stuff without looking at the complement system. So lutein plays a major role in complement. And complement, as we probably all have learned, is a system important for the immunity. It is important for the immune system by removing pathogens and apoptotic debris. There's 3 distinct pathways: the classical pathway, the lectin pathway, the alternative pathway. All these pathways funnel through this process and end up right here, this thing called C5b9. This is also called MAC. This is the membrane attack complex. This causes cell lysis. This is what creates a lot of the problems with somebody that's got sepsis. And when we have an alteration in the complement system, and there's many reasons that you can have that. Infection is one of them. Obesity is another. You can have significant impact on your overall mortality. So lutein has been looked at in relationship to its impact on this C5b9 or MAC, membrane attack complex. And what they found was when you give somebody lutein, you're starting at time 0. You're seeing a significant, over the course of 12 months, you're seeing a significant decline in the MAC, the C5b9, compared to the people that didn't get it, and theirs actually rises. This is incredible. And remember, lutein is a fat-soluble carotenoid, so it gets stored in the adipose tissue. That's one of the reasons why it works like this. So it not only goes to the brain tissue, which is mostly fat, but it goes to the adipose tissue. Lutein supplementation inhibits the systemic activation of the complement system, which provides further functional evidence for the reported benefits of the carotenoid in the management of AMD. AMD is related to this MAC complex, but it's also related to, the MAC complex is related to thrombosis in COVID. So a lot of the COVID research right now is looking at ways to basically to stop the MAC complex. And there's monoclonal antibodies that are being developed. But I'm telling you, you want to be on the lutein. You want to really load up on lutein for a long period of time so that you don't end up having all that MAC spill out from your adipose tissue, and don't overproduce it during a viral attack. So the brain does shrink with Alzheimer's. It shrinks with natural aging, but it goes through significant alterations with Alzheimer's disease. Ben Barres from Stanford, he's dead now, but he was really at the top of the list. And there's Beth Stevens now is pretty much taking the reins now. She's over in Harvard and MIT. But I put this quote up there because I just like to remind people that 80% of the cells in the brain are not neuronal. They're made of glial cells. So these non-neuronal cells really are the ones that are controlling a lot of the neurochemistry and the neurobiology in our brains. It's not our neurons. And so we need to pay attention to these non-neuronal cells in order for us to have proper levels of brain health and have proper neurobiology. We also know that peripheral inflammation activates the brain cytokine signaling system, which results in sickness behavior. This is known as anhedonia. One of the things that happens with anhedonia is you get depressed. And one of the things that happens with depressed people is they get fatigued. These are all secondary markers of inflammation, low-grade inflammation. It doesn't take much for the brain to become depressed and fatigued. It wants to sequester itself when it starts to get into an inflamed state. And that's why, and we're seeing more and more of it today, secondary to the stress response. And remember that slide I showed you that 233% of the Alzheimer's risk is associated with stress. It's associated with it because it activates the inflammatory burden and the inflammatory response. Aging increases the risk for developing inflammation. We become primed as we age for reacting to stressful situation, to reacting to inflammation. And so this sets up this perfect storm as we get older to developing chronic neurological conditions if we don't avert them through proper lifestyle, supplementation, and taking good care of ourselves. So I want to show you this. This is a slide I got from Beth Stevens. She's, like I said, at MIT and Harvard. And what she shows here is this is your brain. This is a mouse brain, and these are phosphorescent glia cells. These are actually live glia cells, and you're going to see in the middle of the screen here, you're going to see a laser make an injury, and the glia respond to PAMPs and DAMPs, pathogen-associated molecular patterns, because the glia, the microglia here, are actually, they're the only non-neuronal cells that come from your bone marrow. They actually migrate in, I think it's the 8th week of gestation, up into the brain, and they actually take residence there. And their origin comes from the macrophage. So they're big eaters, and they circulate your brain every hour, and they clean up stuff, and they survey it to make sure that there's nothing coming in there to hurt you. So what she's going to show you here is, this is real time. She's going to show you when an injury occurs, and think of this as a PAMP, a pathogen, or a DAMP, or like an injury. Let's call it a TBI. Let's call it a concussion or a stroke. This is what the glia end up doing. Now, not only do they run to the area that they want to clean up, but they're also secreting a tremendous amount of damaging molecules to try and kill anything in its way and degrade anything that's there, so that they can basically get rid of it. and start to repair the process. So they're not only are they very active in the response, but they're also very chemo reactive. They start to really shoot out a lot of chemistry that's very damaging to the brain. So check this out. I think that's just fascinating. I could watch that a few times, right? Let's see how to I can move it forward. Huh. Let me see if I can. I might have to go back to my screen. So this is what's going on in your brain on a regular basis, and this is normal and natural. And let's see if we can. Let me go back. Sorry. So this is something that we have to, and this is one of the main causes of Alzheimer's disease, is this hyperactivation of the glial cells. Well, one of the things that we can do to try and offset the glial activity and to basically keep the glia our friend and not our foe, and to have them actually eat the stuff that we want them to eat, like the amyloid beta, is feed these glia cells omega-3 fatty acids. And when you do that, you change the glia from being overly active to being very specifically active. And that causes them to be more targeted towards the things that they should be cleaning up, such as beta amyloid. So this is a study that was conducted a while ago from the Karolinska Institute. This is where they give out the Nobel Prize, right? So this is a fairly well-known institute, the Karolinska. And the present study results support the idea that omega-3 fatty acids and the pathways with which they are associated are promising treatments for Alzheimer's disease and other neurodegenerative diseases because of their impact on the microglia. So, as I said, the brain shrinks as we age. How do we keep it from shrinking? Well, one of the best ways you can do it is maintain the integrity of your DHEA status. 97% of the omega-3s in your brain are composed of DHA, not EPA. So, the Lovasas and some of these prescriptions, those are all EPA. Those don't help your brain. They don't help your brain. And you can't convert them into DHA. The older you are, the less you do. So you need to take a strong DHA, and you can't probably eat enough fish today because most of us are running low on DHA, and you should know what your DHA levels are. 93% of the omega-3s in the eye are DHA. So these are, again, the brain and the eye are connected. They're basically one and the same. So we also know that docosahexaenoic acid, DHA, is also, you can also create these resolvins and these protectins, whereas EPA only basically creates a couple of resolvins, the E series. And arachidonic acid does have some helpful things, but not a lot. We usually have too much AA and not enough of the EPA and DHA. So really creating a balance of more DHA helps not only with these downstream proresolving mediators, they're called special proresolving mediators, is very important so that you can actually keep your brain structure and function intact. Changes in brain volume have emerged as an important clinical indicator of cognitive decline and dementia. The higher the RBC, EPA, and DHA corresponds with larger total brain and hippocampal volume. In other words, the more DHA you have, the higher the volume of your brain is. 97% of the omega-3s in your brain are composed of DHA. So, when you're thinking about how to protect yourself and your patients and your children, your loved ones, think DHA for your brain. We also know that you have this is Ernie Schaefer's work. He's the guy that did the Framingham Heart Study. You guys know the Framingham Heart Study, the largest ongoing clinical trial in human history. It's out of Framingham, Massachusetts. Ernie Schaefer, right up here, He's well known in the cardiovascular circle, but he also looked at is there a relationship between DHA and developing all-cause dementia? This is all-cause dementia, not just Alzheimer's, not frontotemporal, not run-of-the-mill stuff. This is all-cause. And there was a 47% reduction in the highest levels versus the lowest level. So these are the people with the lowest levels. These are people with the highest levels of DHA, and their cumulative incidence is much lower, 47%. And this is only after 12-year follow-up. You can imagine what happens the earlier you start, right? You can see that this is probably has there's a major time element here. So you can, the earlier you intervene, the better you are with these types of things. DHA also helps to improve cognitive function and slow the progression of hippocampal atrophy. I'm going to run through some of these so I don't get too wound up in it. DHA is also a antioxidant. So it's this is the retinal pigmental epithelial cells in the eye. And this is on the left, the control. They didn't get any DHA. This is on the right. And this basically suppressed all the inflammatory oxygen, the reactive oxygen species in the eye when you expose them to DHA. So it acts as an antioxidant. DHA is a major free radical scavenger. Now, people will look at the research and they'll try and say, oh yeah, but this study showed that it didn't work, and this study didn't find any evidence. And you can look at all these, but when you look at when you really start digging into the literature, you can see that they're not using the right dose. And Hussein Yassin from Keck Institute, the School of Medicine at USC, this guy right down here, he's one of the top researchers when it comes to DHA out there. And he's clearly shown now that you need to give people 2 grams of triglyceride-based TG, triglyceride-based DHA per day in order for you to start to get your levels in the brain high enough. And you need to keep people on it for a minimum of 2.5 years. So don't think that just when your number gets to a level, like your brain omega level gets to 10, that you're good, you can stop. You have to hold it there through a lifetime in order for you to continually restructure and repurpose that DHA. Now, Fred asked a question early before we got on here. How does it work? How does it get incorporated? The fatty acids get incorporated as building blocks in the matrix of the membranes of our cell. So the more you have on board, the more, and the cells that are going through repair, they take those fatty acids and they incorporate those into the membranes of the cell. Some cells reproduce very quickly, like skin and epithelial cells of the gastrointestinal tract. Some reproduce very slow, like the neurological tissue. So you have to maintain that level for a long enough period of time, for indefinitely really, for you to start to reincorporate the proper levels of docosahexaenoic acid, EPA, ALA, and even arachidonic acid, so that you can have the proper substrates in these cell membranes to give your cells the proper integrity. Now, I hope this is going to start putting it all together. So lutein and DHA have been looked at, and where they localize in the brains of macaque monkeys, and now more recently now humans now. So when Martha Nuringer was doing this work up at OHSU, she was starting to try and define what is the relationship between DHA and lutein, and how do these work together. And so she has a monkey colony up at OHSU in Portland, and she starts looking at feeding some monkeys lutein DHA and others not. And then she starts looking at where these are located and what the differences are. And what she found was pretty enlightening. And this starts to make sense now that we've looked at some of the other research. But lutein and DHA are distributed into the myelin, the mitochondria, and the neuronal plasma membranes. Supplementation with both lutein and DHA has been shown to provide additional cognitive benefits in older adults compared to supplementation with one or the other. Therefore, lutein and DHA may function together to influence cognition. And here's how they function. So one of the things that happens is I showed you that structure of lutein in a transmembrane orientation. So it was spanning the membrane of the cell. So does DHA and lutein both span the membrane. And what they do is they protect each other. So they're actually there to coexist together. And what they found is there's an inverse relationship to the amount of oxidation that's occurring, particularly in the mitochondria, the energy powerhouses of the cell where most of the oxidation is. And this makes sense because the inner mitochondrial membrane is highly oxidizable. And there was an inverse relationship between lutein levels and how much DHA was being oxidized. In other words, the higher your lutein is, the less oxidation it is. And that makes a big difference in the functionality of the mitochondria, the functionality of the cell membrane. And it also makes a big difference in how that cell starts to present itself to the microglia as a danger-associated molecular pattern, a damaged cell. So the mitochondria, when they get burdened with this oxidation, they become dysfunctional and they decrease their energy efficiency, and you get into this vicious cycle. And they start to change the functionality, and they increase the oxidation burden and the actual lipid peroxidized nature of the cell membrane. Why this is important is right here. Excessive lipid peroxidation is the hallmark for most degenerative disorders, including Alzheimer's, Parkinson's, ALS, and many other conditions. So this is at the very hub of what we're talking about. So they also went on to look at DHA and lutein together, and they found that the combination of the two, this is the genesis of my formula. The combination of lutein and DHA, the combination significantly improved verbal fluency in older adults. And this was significantly improved. So that kind of wraps up that part of it. I also want to make sure that you guys understand that not only are omega-3s good for your brain, but they're really good for your heart disease risk, and they reduce your risk. The higher your levels are, the lower your risk is. You can reduce your risk for people that are in the 8% level by over 35%. And this is Bill Harris. Bill Harris is the gentleman who actually coined the term omega-3 index. He's a friend of mine. I'm actually going to visit him next month in South Dakota. And this is a brand new article he did. Look at the amount of people that participated in this article. And what he found that fatty acids reduce all cause mortality by 15 to 18%. I don't know any drug that really does that. So I do have a brain omega test that I've got in my lineup too. It measures your levels, and you're able to detect kind of where you're at within the range of where you want to be. We try and get people up over 8, preferably up over 10. There is a difference between ethyl esters and triglycerides. Ethyl esters are manufactured. They're done so that they're stabilized, but your body can't use them until they're turned back into triglycerides. The Brain Omega product is 100% triglyceride. So in summary, among the carotenoids, lutein and zeaxanthin are the only two that cross the blood-brain barrier to form the macular pigment in the eye. Lutein is the major carotenoid in brain tissue, despite not being the major carotenoid in matched serum. Remember, serum and brain tissue, they don't match up, indicating that there's a preferential uptake into brain tissue. Lutein and zeaxanthin in macula are found to be significantly correlated in their levels in matched brain tissue. The higher your macula pigment is, the higher your brain tissue is of the lutein and zeaxanthin. Macular pigment can be therefore used as a biomarker as brain tissue, and in fact, significant correlation was found between macular pigment density and global cognition function in healthy older adults. Lutein protects DHA from peroxidation. So here's the Brain Omega product. It's got these are really small capsules, by the way. I designed it so that kids could take it. So 2 soft gels. You get 460 milligrams of docosahexaenoic acid. You get a little bit of EPA. You get 10 milligrams of lutein and zeaxanthin. This is the patented form, lutein, Lutamax 2020. Lots of clinical trials. We use a IFOS. This is an international fish oil standard fish oil. It's not overfarmed. It's got some of the lowest peroxides that you could possibly have in a fish oil. It's coated, so it's not sensitive to light with a natural carob coating. You don't get any repeat or burping. I also like to remind you that you need to be using a B complex. It helps to incorporate the DHA into the circulating phospholipids and helps you get better absorption. This is a B balance that I put together, and it's one of our better sellers too. It's got all the B complexes that you need in it in one capsule. So if anybody wants to get a hold of me, there's my email address. I'm happy to answer any emails. And if there's any interest in carrying these products in their clinic, or they want more information on how to do that, we do have some wholesalers that sell our product online. I can give you access to them, or you can just buy directly from us. And I just want to thank Bill again for allowing me to have this opportunity to share this work.
Thank you, Mike. Great as always. Send us a couple cases. I think we all need it.
Yeah. No kidding. Yeah.
So those of us that are getting younger. So
exactly.
Okay.
I'm looking at some of these questions.
Couple of questions here. Caffeinated or decaffeinated coffee are of equal efficacy when you were talking about coffee early on.
Caffeine does have an impact on brain function, so I prefer caffeine. Some people are sensitive to caffeine. I've got a coffee called Zen Blend, and I've coated it with MCT oil, C8, so it goes into a ketone. I've got ashwagandha on it, pretty significant amounts for a cup of coffee, L-theanine to calm you down, and alpha GPC to give you that acetylcholine. So it's a great option for people that might be caffeine sensitive. It's called Zen Blend, and it's the one I drink.
Okay. Your thoughts on the aluminum connection?
Huge. Yeah, huge. Yep. Yeah, it's definitely involved. In fact, if you look at the vaccines today, they've removed a lot of the mercury, but they've increased their aluminum. And the aluminum incites a very profound and robust immune activation. And this immune activation then, again, the peripheral immune system talks to the central immune system, your brain, and that can incite a whole host of unwanted neurological consequences. So yeah, absolutely, aluminum is involved in this story.
Okay. Any tips on reducing aluminum, the aluminum
how to get the burden out? I know, we actually make some of Quicksilver's products for him. We manufactured some of Chris Shade's products, and he's got a product that we make for him called Ultra Binder. And I think that might be a decent product to help bind. We just started making his capsules for him too. So we do the powders and the capsules, and I'd probably look at something like that. He's got a couple of really cool. He's got a very specific silicified ingredient that we use in it that I believe is specifically for aluminum.
Okay. How about your thoughts on glutathione deficiency with regard to dementia?
Oh yeah, again, if you go back to Bredesen's work, this is a systems problem, and glutathione definitely plays a role in it. It helps to keep maintain the antioxidant protection throughout the body and the brain. It also helps to helps you rid yourself of some of the metals that can be impacting the brain. I think using strategies to improve glutathione, like NAC. We have a NAC product that's got a pharmaceutical grade N-acetylcysteine at 900 milligrams. I think that anybody that is in the world today should be managing their glutathione levels robustly. And if you've got neurological or even peripheral neurological conditions, you should be using something to support glutathione.
Just a little aside, so was it a year ago or so, the FDA decided glutathione was a drug and that they were going to pull it from, supplement markets. Do you have any issues? Did you have any issues with that?
So they didn't recant, but they lightened up. We're back on Amazon now with it. Amazon loosened the grip and they allowed us to come back on with it. So we're able to sell it full force. We never stopped selling it, by the way. We just kept going with it. We thought, this is ridiculous. This is Big Brother trying to come after, it was stupid. They basically will enforce based on their, whether or not they want to or not. And so I guess the less you yell about how good it is, the easier it is for you to stay in business.
I thought it was the opposite. I thought there was a pretty big outcry over it.
There was, but they still held that, and people signed up the petitions, and there was a lot of active participation in trying to get the FDA, but they did not recant it. They just basically said, we're basically not going to enforce it.
Okay, because there's a push for them to get rid of compounded bioidentical hormones. Also, I don't know if you know about anything about that at all.
Yeah.
So the same deal. So,
yeah.
All right. Do you think excess EMFs can enhance dementia?
Yeah. We're bombarded by EMFs, so and they interfere with the mitochondrial electron transport pathways. So those things can really change the biochemistry and the neurochemistry of your body. And so you've got to do a lot to try and offset that. Having good cell membrane integrity is critical. So the less fatty acid composition you have of the right type, the more impactful I believe EMF will be. And don't hold your cell phone up next to your head, and don't use the wireless, use the wired stuff, all the basic stuff. But yeah, I believe that it can definitely impact neurological function.
Okay. What is your opinion about saffron for macular degeneration?
I don't know a lot about it. We've looked at saffron for other things like inflammation, but I haven't looked at it for AMD. I haven't seen much on that. I mean, I pay pretty close attention to the carotenoid literature, and I haven't seen. I could look at it, but I haven't seen much on that.
Okay. What is your opinion on coffee berry extract?
Yeah, well, coffee berry extract is basically chlorogenic acid, and we actually standardize. When I roast my coffee, I roast it to preserve the highest concentration of chlorogenic acid possible. Chlorogenic acid is a way to basically liberate fat and burn fat for energy, and it's been shown it's very effective. And when we go and test our coffee after we roast, the chlorogenic acid, when I took off like Starbucks and I tested theirs against ours, we had 2 times the chlorogenic acid. That's why we call Starbucks Charbucks. The more you roast it, the more you denature the chlorogenic acid, and you lose a lot of the polyphenols.
Do you have an opinion about ahi flower oil versus fish oil?
Ahi, you're talking about the tuna oil?
Dr. Fishbein asked that question.
Yeah, I don't know. I kind of look at it through the lens of the DHA, EPA, ALA type. So, and then the whether or not the oil is clean and how it's actually the structure of the oil, whether it's esterified or it's triglyceride. So I don't know a lot about the other ones. I know krill is a big deal, and krill is definitely good. We use astaxanthin. I chose not to jump into the krill circle. I felt like astaxanthin was a better solution. It's very similar to krill, and it has a tremendous amount of other research around it as well. But I don't know a lot about the ahi versus regular fish oil.
Okay, we got a great talk, and thank you from Dr. Crowley. Dr. Hartman, I'll try the test out. Oh yeah, tell us about the test, the omega test. Is it a blood test? What kind of test is it?
Finger prick. I'm reworking the entire array of testing. I've added a whole bunch of new test analytes to it. So we're testing things like nirvanic acid, we're testing oleic acid. These are all important for myelin synthesis and brain structure. We look at AA, EPA, DHA, EPA, omega-3 index. What else do we have on there? We have a whole host of new analytes that we're going to be testing, and that'll be out after I go visit with Bill in South Dakota next month.
Where do we get these tests? I mean, do we
on my website? I've got everything on brainbean.com, brain-bean.com, and then my email address is basically mnelson@brain-bean.com. But if you go to BrainBean and you go to info, our customer service people will get me any of the questions, or if you don't remember my email address, and get me your details, and I can get back to you.
Right. Okay. What nutritional foods have you added or stopped with all your research and experience on the brain?
Well, I mean, I've been a clean eater for a long time. One of the things I probably added that I didn't have a while ago was more parsley, and mostly for the apigenin. I've got a new NMN apigenin NAD product that's coming out that's going to be just a blockbuster. I think it's a really cool product. So I've added quite a bit more parsley to my salads every day. I don't eat sugar. I don't eat grains. I use a lot more collagen. I have a collagen product that we use the patented peptides from Gelita. We've got 3 of those in our brain body. We just came out with a chocolate too, no sugar. And I use a lot of that for my protein. I was surprised. I was able to take, I weigh 177 pounds pretty consistently. It's about what I weighed in high school. And when I first started, my body fat was in the 25s, and I've got my body fat now down to under 7%. So, and I haven't really done much else. I still work out, but I think the composition has changed secondary to having better protein in my diet. I'm in my 60s now, so I think that's really important to have, not to end up with sarcopenia.
Okay, great. Okay. Can I ask you what the cost is for the BrainBean DHA?
I think our retail is $52, but wholesale is less than that.
Mm-hmm.
Yeah.
Okay.
So just contact me, reach out to me, and we'll get you guys set up on a wholesale. You can order 1s and 2s at the wholesale level, and you can just get going on it and make sure that you guys get on this stuff. I can't tell you how important it is. It's super important, as hopefully I was able to convey.
Do we need to be concerned with knowing a patient's ApoE genotype when suggesting supplement with fish oil?
Absolutely, 100%. So that article that I showed you that showed that you need to take 2 grams a day, that's Yassine. He is an ApoE4 expert. And that's why he came out with that statement, because most of the studies done with the ApoE4 group weren't using enough. I'm ApoE4 hetero, so I know this literature fairly well. And you definitely need to know an ApoE status. So ApoE4s have they have a hard time absorbing fat. So you need to give them a lot more of the omega-3s than you would a non-ApoE4, and you need to keep them on it longer during the process of getting them up to sufficiency. So make sure that if you do know the ApoE4 status, you explain to them that they're going to need to take more because of it, and they need to be on it, and may take longer for their levels to get to sufficiency. So yeah.
All right.
Good question.
Dr. Sherman, thanks for the great information. Do you use Prodrome testing in your practice?
Yeah, I looked at it, and I talked to the gentleman at the lab there. I forget his first name, but great guy. And when I told him what I was doing, he goes, "You're probably increasing your levels of what he measures, because DHA is a direct precursor to the stuff that he's measuring." And I actually want to do that. I'm very interested in that, and I do a lot of testing on myself. So I think stuff like that is very interesting, but I don't use it right now.
He measures the plasmalogen.
Plasmalogens, yeah. So the plasmalogens, yeah, he believes that in his book he even talks about DHA
Dr.
being
Goodnow. Dr. Goodnow.
Yeah, yep, good guy. He talks about it being the DHA being one of the major precursors for the plasmalogens.
Okay. Some of us don't know that term. Can you elaborate on that a little bit?
So it's a I don't know a lot about it, but it's basically a fatty acid that is very important for maintaining proper brain function, and he makes it. And I'm not sure how he does it, but he actually either distills it out of another fatty acid or chemically does it, and then he delivers it to people, and they take it and they significantly improve their plasmalogen levels, and it improves their overall cognitive capabilities. And these are really deeply entrenched MCI patients. These people are having significant problems. Mm-hmm. And he measures them pre and post. It's pretty spendy. I don't know a lot about it. I'm interested, but I haven't taken the time to actually do the testing, which I really need to do.
Got it. Okay. We have in the chat, we have your website, brain-bean.com, and then mnelson@brain-bean.com for email if anybody wants your information. Mike, I can't thank you enough.
Yeah.
Any final thoughts?
No, I just think, I hope this shed some light on some things that you guys can do for yourself.
Yeah, no, this has been great. I hope you'll come back again in a little bit and, give us some other information.
Sure.
Anybody else have any comments, questions? Next week, just to give you a heads up, we have Dr. Clyde Porter, and he's going to be speaking on qualification and quantification of protocols and remedies for muscle testing. So, we hear a lot about it. A lot of us do it. It's good to have an expert, to sort of help fine tune us if we, most of us formerly were never taught how to do muscle testing. So I thought that would be an interesting topic. Mike, fabulous. You're even better than the last time I talked to you. So if that's even possible. We had Dr. Pam Smith dropped out on October 11th. She had a conflict. So we have in about a month, 4 weeks, we have an opening. If anybody wants to fill in, let me know, or I'll find somebody. We'll be back. Any questions of anything before we go? If it's Going once, going twice. Everybody, thank you again so much always for being here. Please bring one friend and we can double our attendance. If everybody brings one friend, you see me, I bring one every week. So, and how about Dr. Burgess? You have anything to add? I always,
No, just what an excellent lecture. Thank you so much.
You're welcome.
Thank you.
pleasure.
Thank you, Mike. As you all can see, so I'm unleashed again, as you all can see. Mike, you don't know this, but the AOA decertified us. They threw us out. They said our education was not up to their standards.
You must be on the right track.
We are.
Yep.
But they told us we could still come to their scientific conference in Boston in October, and then 3 weeks ago they told us don't bother. So, they really don't want us there. So, I've been on sort of cruise control. It's been pretty nice actually, not having to stay up till midnight every night working on nonsense for them. So anyway, again, brain-bean.com, M. Nelson at brain-bean.com is Mike's contact. If you want the really good stuff, he's got it. That price you have, I mean, I've seen, fish oils for, that and more.
180 capsules.
Yeah. And I know, I know Mike doesn't do anything with it that's not above board. So thank you again. We'll see you guys all. Anybody else have any comments or questions? Same time, same station. Next week, we'll learn about some muscle testing. And Mike, I'm gonna probably hit you up in a couple of months to come back for another
You got
talk. Okay.
You got
All
it.
right. Thank you all, everybody. And
Thanks, Bill.
okay. And we'll see you again next week.
Okay, bye.